thank you for joining me. This is Dr. Erica, pharmacist. Thank you for joining me on this particular video, part 2 of coronary artery syndrome, artery coronary syndrome. Now, this particular video is going to talk about a couple of medications that are used in the first 24 hours of a person developing symptoms of heart attack, which involves deoxygenated heart cells on the tissue of the heart that are being depleted, and the heart is responding with pain, with lack of oxygen, and so also the potential for further blood clotting along the coronary arteries due to plaque development that has now been addressed at this particular point in therapy. The patient usually going to receive oxygen if there's ST segment elevation. They'll also receive aspirin for blood thinning. Also, they'll receive anticoagulant for platelet thinning, removing clogged platelets. Also, they'll receive nitroglycerin to help dilate and open up the arteries so that cardiac output can increase. Also, the blood pressure can increase and resistance can decrease. Also, the patient will receive later on ACE inhibitors, beta blockers for rate control as well, such as your carvedilol, metoprolol. Now, those particular ones are specific because they are known to reduce mortality rate. They are specifically introduced because they are known to reduce mortality rate. There are medications other than these called the beta blockers that can be used, but these particular ones are preferred first. Now, aldosterone antagonists are medications that are used after ACE inhibitors, after the fact that the patient is still experiencing heart failure symptoms. Now, during hospitalization, and they have an ejection fraction less than 40%. So at this particular point, the patient has received a thiazide diuretic. There's still elevation of fluid on the heart. The heart is not pumping as much. There's some systolic dysfunctioning. There might be some diastolic dysfunctioning. The ejection fraction has decreased. So the aldosterone is going to play an important role in this particular situation, but just because it's going to promote vascular output and myocardial fibrosis depletion as well. And it promotes hypertension, also sodium retention and potassium and magnesium loss, and arrhythmias. Okay, it has been shown in human studies to have a great effect in this particular area of study. Examples of aldosterone antagonists are going to be like your spironolactone, which is also used as a diuretic, but you won't see it used as a diuretic as much, but it does have diuretic properties, and it's potassium sparing when it works in the kidneys. So its mechanism of action is that it's going to help rid the body of the extra fluid, but it's going to help spare potassium. So if a patient has potassium in their blood levels, potassium will be accumulated from this particular class of medications. Okay. Eplerenone is also a medication. Eplerenone is another medication, such as spironolactone, in the class as well. Okay. And it blocks the mineralocorticoid receptor. It has no gynecomastia properties. It does not work in the pituitary area of the brain, so we're not going to see that development. Also, no effect on progesterone or androgen. Also, sexual dysfunction and menstrual irregularities are not seen with this class of medications. Although it is an aldosterone or mineralocorticoid receptor, so it does have some, because it's the mineralocorticoid receptor antagonist, it has an effect as a steroid. That's why the side effects that I just mentioned may or may not be seen, but it has been shown with use and over time that it does not have that effect on the particular gynecological effects. So that is a plus. We want it to work where it needs to work without having to deal with the side effect that the patient could possibly feel. Okay, so it has been studied significantly. It reduces the risk of mortality, and that is a very um, um, impressive indication that we want, just because this is a very emergency acute situation. All medications that are involved in treating coronary artery syndrome must have some sort of positive effect on reducing mortality rate, such as, again, the beta blockers and the aldosterone antagonists as well. Also, the lipid lowering medications, LDL lowering medications, are also important. So we do want to make mention of those particular class, such as your statins of medications. Reducing LDLs helps to reduce more cholesterol buildup along the arteries of the coronary artery wall. And then your ACE inhibitors are also known to reduce mortality as well. They're going to help bring down the blood pressure, help get control of the heart rate, and also calcium channel blockers as well are good, such as the amlodipine. Okay, amlodipine is very important. It's used after a patient has received an ACE inhibitor, a beta blocker, and there's still no control of the heart rate, then they will receive a calcium channel blocker. If the patient has experienced fluid overload, they'll get a loop diuretic along with their thiazide diuretic as well. Now, the thienopyridines are a class of medications that reduces platelet aggregation in the blood. Platelet aggregation is very important in reduction of blood clotting. Okay, this particular medication class is going to include medications such as your prasugrel or Efient. Also, the other medication is going to be clopidogrel, also is known as Plavix, which is going to help with platelets. Platelet not forming, Plavix and the Efient. Okay, they work by irreversibly blocking a type of component of the receptors on platelet surfaces, preventing activation of the GLP-2A and 3A receptor complex, which reduces platelet activation and aggregation. Okay, and again, those examples are going to be your Plavix, oral, and your Efient, oral by mouth medications indicated for lowering the rate of thrombotic cardiovascular events in patients who are being managed with either for the extended ST interval or the non-extended ST interval. Also, those who are going through the angina, the unstable angina or unstable heart pain or feeling of aflutter and AFib. Those type patients will receive this particular class of medications, and that's called the thienopyridines. Okay, they are, again, platelet desegregation medication. So we don't want platelets to come together to cause the clogging. Now, the American Heart Association has more information, as well as the American College of Cardiology has more information about what to expect after receiving a myocardial infarction or heart attack. And they will discharge patients on all medications that they've been stabilized on, and they'll follow up with the patient to make sure that they are stable consistently and that they are following all routine directives by the team of cardiologists, and also they'll make sure that the patient's not using tobacco products or have any adverse effects from the medications or drug classes. So again, thank you for joining me on this particular video. This has been part 2 of angioplasty strategies, clogged arteries, and medications being used. Thank you for joining me. Please subscribe to this channel. I hope to see you on the next video. Take care. Bye-bye.